Hello there, I'm Dr. Tom Ashton. I'm here to talk to you a little bit about cannabidiol. Cannabidiol is CBD, as you know, and the main thing I want to cover, we'll cover four aspects of this substance. Number one, we're going to talk about the actual product in itself and what it does. Then we're going to talk about how it is an anti-inflammatory substance that is very important for our bodies. We're going to talk about the problems that presently exist, and then I'm going to tell you what our mission is. So basically the CBD product is that portion of the cannabis that is non-psychogenic. You're not going to get high on CBD. And the other thing is you're not going to get arrested for using it, and it's not going to affect your blood test at work. That's the good part about it. The other thing I want you to know is that CBD already exists in our bodies. So it's not like it's some kind of weird chemical that we're putting in our bodies to create a problem like Tylenol, Aleve, and the other non-steroidals. And even steroids are used for anti-inflammation, but there's so many side effects that it's becoming unnecessary to deal with those. So we know that you can obtain CBD products at gas stations, 7-Elevens, Walmart, just about anywhere they want to sell something, there'll be a shelf there with CBD products. Now, here's why. It's becoming so popular because the substance CBD is one of the most amazing anti-inflammatory substances known to man. And it's anti-inflammatory. That means that, well, let's talk about disease entities. All disease entities result in inflammation. That's the bottom line for disease. Whether it's an infection or a traumatic episode or a stress and strain on a muscle or a tendon, the part of the body becomes inflamed. And inflammation can be noted by pain, swelling, redness, and many aspects of inflammation are almost occurring on a daily basis with almost anyone who is active or aging. So we know that our bodies have anandamide, which is CBD produced by our own bodies, and there are receptors on many cells in our bodies that require, for optimum function, this substance to be present. Now, here's the very interesting thing about CBD and anandamide. Anandamide is the endogenous CBD-like substance. As we age, our body produces less and less of this. Even though the receptors are there waiting, there's no product available because just like testosterone declines and estrogen declines and other substances that we produce when we're young become unavailable to us in a rapidly declining manner as we age. So if we can replace some of these substances, we can feel better, look better, and be better. So I think CBD is one of those products. But let me cover the problems with CBD as it's presently being used. As I said, you can get it just about anywhere. You do take it by mouth, which means it goes through the intestinal system and is somewhat degraded there, but it is still very useful. So the problem with it is that it's not regulated enough to know that your product that you get from 7-Eleven or a gas station, you don't know how pure it is, how the hemp was actually grown. You don't know that it's organically certified, and you don't know that there's lab testing being done that's going to guarantee the purity. So that's why I'm getting involved, because as a physician, I need to know that what I'm going to recommend is going to be not only effective, but also safe, no side effects, and no impurities. So those are the problems with it. But the other problem is if you go to a store and get some CBD, you're not sure if the dose that you're using is appropriate for your situation. That's another thing that's, it's just like trial and error. You take a little bit and you see if it helps, and then you triple or, take a lot more, and maybe you'll get too much, and you're wasting your money and you're wasting your time, because there's only so many receptors in your body, and you don't need a lot of this substance to really have a great effect. It needs to be more controlled and clinically adjusted for your particular condition. So those are the problems, but the solution is clinical trials. Now, I'm doing my own clinical trials in my own patient population, and I have patients with amazing conditions of inflammation, and I treat some of these patients by recommending CBD products. However, it is not a silver bullet. It's not effective like a magic wand. It is part of an holistic approach that would require other aspects of your lifestyle being modified. I teach basically about how to use CBD for anti-inflammation, but I also teach you have to have a good diet, you have to have plenty of exercise, and you have to have a lifestyle that is conducive to lowering your stress. So when you combine all those things with the use of an extremely effective CBD product, you have a much higher chance of reaching your potential in your life as being well, healthy, and for the long term. So our mission is to help everyone obtain the maximum level of well-being that is possible based on their situation. So if you have any questions, let us know. I'm highly enthused about this CBD product, especially when we know that it is pure and we know how to regulate the dosage and the use combined with other approaches that will assure that the inflammation in our body is controlled once and for all. So until next time, thank you very much. And if you have any questions, I'd be happy to answer those. You can contact me through this website. Until next time, this is Dr. Thomas Ashton. Thank you very much.